As an athletic trainer for over 20 years, I've worked with baseball players from the very elite professional level down to youth sports. I do feel it's extremely important for a thrower to understand how the throwing shoulder works, and the need for scapular stabilization is part of that understanding. Throwing a ball is one of the most eloquent and yet most violent motions in sports. To really appreciate and understand why a thrower needs to address the rotator cuff and scapular stability, they really need to understand the anatomy of the shoulder and how it works. So what I've done, I've put a few slides together. I won't digress too far into the detail because I have some videos, and then at the end, some exercises to help provide strengthening of the rotator cuff and scapular stability. So let's take a look at the anatomy. And again, buzzwords around the baseball park of rotator cuff, labrum tears. I mean, all those things are pretty dramatic. A couple of pictures just for some basic understanding. The acromion area and the glenohumeral joint. You'll note in some further videos, we really look at this space here, and it's not very much. And to understand that area will give you a better picture of why rotator cuff injuries happen and the need for stabilizers to be working effectively. Another anatomy that's often injured and unfortunately is what we hear about labrum tears. So what is the labrum? The labrum here, this area, this whole circular area, the labrum is essentially a rubberized O-ring that helps make that socket a little bit deeper, the glenoid socket deeper, because the glenoid is very shallow socket, very similar to a tee for a golf ball. So all the stability, or the vast majority of stability of that joint, really comes from the muscles around it because the socket's not very deep. So if they're not working effectively, the ball is going to fall off the tee, and then that's, again, bad things happen. So what is the rotator cuff? Back in school, we learned it as the sits muscles, the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. The rotator cuff is really these four muscles that initiate on the scapula, on the shoulder blade, and all form essentially a common tendon on the head of the humerus. And it's also important to see when you see this picture where the shoulder is in a neutral position, and to understand what happens when you raise your arm and where your elbow is roughly at the height of your shoulder, and how the mechanics and the anatomy change. Really important. Their job is to do two things. Three. One, to externally rotate in the cocking phase, but that's not a very violent motion. What they really need to do is they do two really important things. One, they hold the ball in socket, and that's really important. And two is they're the decelerators. At the point you let go of the ball, they fire to begin to slow down the arm. And that's a pretty violent motion as well, because you've fired up and you're propelling that ball. So what happens over time, if they're fatiguing via multiple deceleration acts, then what happens is they're doing a less proficient job at holding the ball in the socket. And again, that's why it's really important to work on your scapular stabilizers and rotator cuff. Again, here's just a front view of the right shoulder. And here's the critical view again, is this area, the acromial arch and the humeral head, what's called the greater tuberosity out here. That's where they all attach. And you'll see in the next picture, what happens is that as the shoulder is abducted, which means it's being elevated away from the body to the side and following out here where the elbow is out here, this space is even less, it decreases. So again, there's not a lot of room for that ball to move around up and down, to oscillate without pinching off or tearing, or what's called an impingement syndrome in the rotator cuff. So again, that's why it's really important to maintain function of the rotator and scapular stabilizers, or this will happen. And then the scapular stabilizers itself. The scapula, also the shoulder blade, is really a false joint. It's really not connected to anything truly. So these muscles, your rhomboids, your levators, your trapezius muscles, all need to work in concert to hold the scapula in place, so it works in concert with the glenohumeral joint. And these are not big muscles, and it's really important to work on them, and it's also important to work on them in balance. So right-handed, left-handed thrower, you need to work on both sides, and that's really important. So front side versus back side. Front side, that's your pecs, your biceps. It's all the muscles we see in the mirror, and we have a tendency when we're in the weight room to focus on those muscles because we like the way they look, and they're the big muscles that we think that are throwing the ball forward. We don't really recognize or focus too much on the back, do we? The front muscles are the big muscles. The back muscles, not so much. The front muscles are the muscles that are propel your arm forward. The back muscles are the ones that decelerate and also stabilize the glenohumeral joint. Problem happens when these muscles fatigue and or when we shorten the deceleration phase. So every time you let go of the ball, those rotator cuffs, those stabilizers are firing to slow your arm down. We work so hard to get it going fast, one of the fastest motions in sports. So as they fatigue over time through deceleration and their attempts to stabilize, as they get tired, then they're doing a less effective job, particularly of holding the ball in the socket. And as the ball in the socket starts to move around, bad things happen as we go back to the acromial arch and impingement syndromes. The throwing shoulder is like a set of tires. The faster we start and stop, the less mileage we're going to a set of tires. So you need to lengthen your deceleration phase. You're lengthening your follow through. Those are going to be great things. Also, they need to be in balance. So right side, left side, even though your whatever dominant shoulder is, you really should be working both sides. And particularly when you're talking about scapular stabilizers and how they attach to the spine. Really important. We warm up to throw. We don't throw to warm up. When I was working with college athletes particularly, and we always had TheraBands in our bags, and before a thrower would pick up a ball, they would take their bands and work on some external rotation or go through their joke program, basically to fire those muscles, activate those muscles prior to picking up a ball. So those decelerators, those stabilizers are already ready to work before we pick up the ball. So I think that's important. So let's watch a few videos, a little bit more of anatomy, some biomechanics, and then some exercises. Let's take a look.
The shoulder is an elegant piece of machinery. It has the greatest range of motion of any joint in the body. However, this large range of motion can also lead to shoulder joint problems. Understanding the different parts of the shoulder can help you understand how the shoulder works, how it can be injured, and how challenging recovery can be when the shoulder is injured. The important structures of the shoulder can be divided into several categories. These include bones, joints, ligaments, tendons, muscles, nerves, blood vessels, and bursa. The bones of the shoulder are the humerus, or the upper arm bone, the scapula, or the shoulder blade, and the clavicle, or the collarbone. The roof of the shoulder is formed by a part of the scapula called the acromion. There are actually 4 joints that make up the shoulder. The main shoulder joint, called the glenohumeral joint, is formed where the ball of the humerus fits into a shallow socket on the scapula. This shallow socket is called the glenoid. The acromioclavicular, or AC joint, is where the clavicle meets the acromion. The sternoclavicular, or SC joint, supports the connection of the arms and shoulders to the main skeleton on the front of the chest. A false joint is formed where the shoulder blade glides against the rib cage. This joint, called the scapulothoracic joint, is important because it requires that the muscles surrounding the shoulder blade work together to keep the socket properly aligned during shoulder movement. Articular cartilage is the material that covers the ends of the bones of any synovial joint. Articular cartilage is about 1/4 of an inch thick in most large weight-bearing joints. It is a bit thinner in joints such as the shoulder, which don't normally support weight. Articular cartilage has a rubbery consistency. It is very slippery, which allows the joint surfaces to slide against one another with very little friction. Articular cartilage functions to absorb shock and provide an extremely smooth surface to make motion easier. There are several important ligaments in the shoulder. Ligaments are soft tissue structures that connect bones to bones. The joint capsule is a watertight sac that surrounds a joint. In the shoulder, the joint capsule is formed by a group of ligaments that connect the humerus to the glenoid. These ligaments are the main source of stability for the shoulder. They help hold the shoulder in place and keep it from dislocating. Ligaments attach the clavicle to the acromion in the AC joint. Two ligaments connect the clavicle to the scapula by attaching to the coracoid process, a bony knob that sticks out of the scapula in the front of the shoulder. A special type of ligament forms a unique structure inside the shoulder called the labrum. The labrum is attached almost completely around the edge of the glenoid. When viewed in cross-section, the labrum is wedge-shaped. The wedge shape and the way the labrum is attached create an elevated rim around the glenoid socket. This is important because the glenoid socket is so flat and shallow that the ball of the humerus does not fit tightly. The labrum creates a deeper cup for the ball of the humerus to fit into. The labrum is also where the biceps tendon attaches to the glenoid. Tendons are much like ligaments, except that tendons attach muscles to bones. Muscles move the bones by pulling on the tendons. The biceps tendon runs from the biceps muscle across the front of the shoulder to the glenoid. At the very top of the glenoid, the biceps tendon attaches to the bone and actually becomes part of the labrum. This connection can be a source of problems when the biceps tendon is damaged and pulls away from its attachment to the glenoid. Four tendons connect the deepest layer of muscles, the rotator cuff muscles, to the humerus. Just before these muscles attach to the upper end of the humerus, they join together to form a single tendon called the rotator cuff. The rotator cuff muscles lie just outside the shoulder joint. These muscles help raise the arm from the side and rotate the shoulder in many directions. The rotator cuff muscles and tendons also help keep the shoulder joint stable by contracting and holding the humeral head tightly in the glenoid socket as the humerus moves. The large deltoid muscle forms the outer layer of shoulder muscle. The deltoid is the largest, strongest muscle of the shoulder. The deltoid muscle provides the power to lift the arm once the arm is away from the side.
We talk about biomechanics a lot as it relates to the shoulder, and everybody has a little different understanding of what biomechanics actually means. And if you look it up, it basically says the study of mechanical laws as it relates to movement of a structure of living organism. So for the purposes of our talk today, we're going to talk about the shoulder. And so when we think about the shoulder, we really know that its main function is to position the arm in space. Now, whether it's grabbing your cup of coffee in the morning or putting your arm in abduction, external rotation to throw a baseball, your shoulder's function is to position your arm in a certain position. And it has four joints, as Dr. Ahmad talked about. And the two that we'll really focus on today are the glenohumeral and the scapulothoracic. Not to diminish what the AC and the SC joints do, but as far as the throwing motion is concerned, it's mostly the glenohumeral and the scapulothoracic joints that need to work in concert for you to be able to effectively throw. And so when you think about throwing, when you think about the shoulder, we have to really think about the whole kinetic chain, because we know the shoulder is just one part, is actually the end part of really the throwing motion that starts at the lower extremities and works its way up. And there's a significant amount of torque and tension and velocity that goes into the shoulder and elbow every time you throw. About 7,600 roughly degrees per second is what the shoulder sees as it's going into the acceleration phase, and the elbow is more like 2,500. So there's a lot of force that goes across the shoulder when it's throwing. But as I mentioned, the throw is more than just the shoulder, it's the kinetic chain. So if you look at Aroldis Chapman reaching 105 miles an hour on a fastball, there's more to it than him just getting his shoulder in the proper position. He has to start with his stride length. So he has to have his stride length that's actually 120% of what his height is. You can see most pitchers are around 87%. He gets up to 120% of what his height is. His stride speed, he's much faster than the majority of pitchers. His hip to shoulder separation, which is something we're going to talk about a little bit throughout the course of this meeting, which has become more and more something that we focused on in regards to pitching injury prevention and fatigue and things like that. Usually pitchers, when they throw, their back shoulder is behind their midline a certain percentage. His is about 65% behind, which is a lot more than average. And then he accelerates in that acceleration phase much faster than most pitchers, about twice as fast. And so I want to just break down the pitching cycle, and we'll go through each phase individually. So when we talk about the wind-up phase, it really starts when the pitcher starts moving and ends when their knee gets to their maximum height. So you can see here, that's basically the end of the wind-up phase. And there's not really much going on from the shoulder and elbow in this phase. You see a little bit of trapezius and serratus and deltoid muscle activation. And when I have on here MVIC, that's your maximal voluntary isometric contraction, so how much your muscle can contract. So really, you're only looking at 18 to 20% of what the muscles can actually do in this phase. And so when we move on to the early cocking phase, this is when we start to see a little more activation. So this starts where the last one picked off, similar to all the phases. So it starts at max knee flexion height, ends when the front foot hits the ground. And in this phase, the shoulder starts to come into what I like to call kind of the semi-cocked position. So it's 90 degrees abducted, but it's really not externally rotated yet. Every pitcher is a little bit different in how much external rotation they get at the start of this phase. And you see the supraspinatus and deltoid working here. But more importantly, you see the scapula working here. So the muscles of the scapula, the middle trap, the rhomboid, the levator, and the serratus really have to put the glenoid and the scapula in the proper position to make a stable foundation and a stable base for the humerus to rotate against. So if the scapula is not in the proper position, you can think of the foundation of the shoulder not being actually where it needs to be. So it kind of affects things down the road. So in this particular phase, it's really important for the scapula to be in the proper position. And then as well, you see a lot of things for the lower extremity going on here. And you can see here his pitcher throwing. Basically, his knee was at his max height. He doesn't flex his knee very high. And as he starts to bring his arm back and up, he brings his lead leg forward. And as his front foot hits the ground, you can see his shoulder, his back shoulder still turned back past midline, and his arm's kind of in that semi-cocked position. Then we move on to the leg cocking phase. And this is where we always talk about pitchers getting injured. Leg cocking, early acceleration. The leg cocking phase is really from when that foot touches the ground to when your shoulder hits its max external rotation, which for me is 90 degrees, but in pitchers is more like 120 to 160 degrees. And in this phase, there's a lot of different things going on. So you have some of the scapular muscles and the pec muscles active kind of to keep the shoulder concentrically reduced. You have the external rotators working to get the shoulder maximally externally rotated. And then you have the subscap and the biceps working to kind of keep the humeral head centered. And we're not exactly sure what the biceps does, but we have an idea that what it wants to do here is to compress the humeral head against the glenoid, so to prevent any type of micromotion where we don't want it to go. Things like internal impingement can happen when the humeral head rides a little too high, so the biceps helps to depress the humeral head. And then again, you see the scapula being important here. So the scapula in this part has to make enough space between the humeral head and the acromion so that when you come into that abducted externally rotated position, the humeral head doesn't bang into the acromion. So you have to make sure that there's enough clearance there, which is putting the scapula in that position of retraction to make sure this happens. And you can see here, it's a very quick phase. It's not as fast as the next phase we'll talk about, but it's pretty rapid. And so when that shoulder gets into that maximally externally rotated position, that's kind of the end of the leg cocking phase. And then we get into the acceleration phase, which is very quick. It's only a couple of milliseconds, and it really starts from that maximally externally rotated position to ball release. This is hands down the most explosive phase. It's actually not the most violent phase, but it's the most explosive phase. And you see the internal rotators like the subscap and like latissimus that Dr. Romeo will talk about later, really very active during this phase. And as we move on to the deceleration phase, this is when you see ball release to maximal shoulder internal rotation. So the internal rotators are still very active, but you're seeing a lot of shoulder compressive forces during this phase. So if you think about it, the pitcher has generated so much force to release that ball, now your body has to slow down the arm. In order to slow down the arm, you basically have to prevent it from not coming off your body. So the internal rotators are very active here. You have to have a lot of compressive forces coming across the shoulder, almost to about 100 pounds worth of force that compresses the glenoid, it compresses the humeral head into the glenoid. So it's almost like reaching over your head with a 100-pound dumbbell and holding it up like this with one arm. So that's kind of what you see in the deceleration phase. So there's a lot of compressive forces and shear forces that are going on here. The posterior structures in your shoulder also see a lot of force here as well. And that's actually one of the reasons that we think we see posterior capsular tightness. So we always talk about internal rotation deficit, the posterior structures are tight. Well, the deceleration phase actually stresses those structures a great deal. It's about 40 to 50% your body weight worth of shear force going on the back of your shoulder during this phase. And so over time, those tissues become less compliant, they become tighter, and then we start seeing pitchers lose some of their internal rotation, and then we can see problems down the road with that. And finally, I'll just show you the deceleration phase. You can see how much motion is there in the arm. You can see his arm moving side to side. And then finally, we kind of end with the follow-through phase. This is really from max internal rotation to when the body stops moving. In this phase, there's really not much going on with the shoulder. You've already decelerated the shoulder, so there's not much else going on. So really, just to summarize, throwing mechanics, shoulder mechanics, it's all related to the kinetic chain. Starts at the lower extremity, works its way up, and having things in proper positions actually will help decrease injury and help pitchers pitch efficiently. The scapula is very important. Having a stable base for anything you do is always the most important thing. So having the scapula in the proper position, having it be the foundation for what the glenohumeral joint uses to rotate around is extremely important. And proper mechanics. We're going to talk about mechanics throughout the course of the next 2 days, and we're going to see how mechanics can potentially decrease or increase injury rates based on how pitchers are throwing. Thanks.
Your shoulder is one of the most important parts of your body when you're talking about baseball. One of the greatest things you can do is they're called jobs. We're going to go from different angles, and we're going to give our shoulder, our rotator cuff specifically, a little resistance to build some strength to prevent injury. The first exercise, we're going to take it at a 45-degree angle like we're shaking someone's hand. 5-pound dumbbells, we don't want to go over that because we want to work our rotator cuff. If we go any heavier, our deltoids are going to kick in. So we want to stay about 5 pounds. We're going to go at a 45-degree angle, arms got to be straight. When you lower, about 3-second counts on the way down. The exercise is more important to go 3 seconds on the way down than it is to go up. When we throw the ball, our arm is going to rotate, and this is where all the injuries happen on the slow down part of the throw, okay? So what we want to do, by decelerating here with the dumbbells, we're going to work the same muscles as we would to decelerate our arm when we pitch. If all you're doing is going up and down, we're never working on the decelerators. So 45-degree angle, 3-second counts on the way down. Next exercise, we're going to go through the lateral plane here. Arms again are straight. Got a good grip on the 5-pound dumbbells. We're going to come up here, 3-second count on the way down. Make sure you're keeping good posture and your chest stays big. Don't roll your shoulders forward. Don't sit in a funny position. We want to have good posture. Chest is up, 3-second counts on the way down. Next one here is a little different. You're going to roll your arms in, and we're going to go on that same 45-degree angle, but our arms have to stay straight. So this was the first exercise. This one, we're going to roll our thumbs down to the ground. Get it here. 3-second count on the way down. Here you're going to have a tendency to bend your arms a little bit. We must not do that. Keep your arms straight so the pressure stays in our rotator cuff. We want to work the decelerators at every angle here. So 3 seconds on the way down. Get it up. 3 seconds on the way down. This next position here, we're going to need to get on the ground. Put your arm underneath your armpit for a little bit of support. We don't want to let the elbow sink, so it's not a natural arm position here. So if you grab a towel or use your arm and stick it under your armpit so you support your shoulder, now you're going to sit at a 90-degree angle here with your arm. Externally rotate, 3-second count on the way down. Great for external rotators. Remember, don't forget about the 3-second count. If you're just letting it drop, we're defeating the whole purpose of the exercise.
When you're getting ready for your baseball season, or if your shoulder has been bothering you, these are some basic exercises to help you strengthen your rotator cuff and hopefully avoid further injury. This is internal rotation using a rubber band or some surgical tubing. Notice the position of the towel between the arm and his side. This puts you in the optimum position to strengthen the rotator cuff. This is external rotation. Again, note the position of the towel. Also, notice the position of his shoulder blades. They're down and back like a Marine standing at attention. These are exercises called a flexion, and then the next one will be flexion out to the side at 45 degrees. These dumbbells are light dumbbells, 3 pounds maximum. Again, notice the position of the shoulder blades, which are down and back like a Marine would hold his shoulders. This exercise is really important for throwers. Again, with a light dumbbell, you externally rotate, push up toward the ceiling, and then turn your thumb toward the floor as you slowly lower to the floor. This is a great exercise for getting ready to throw and to get your rotator cuff strong for throwing or tennis. In this video, we'll review the level 2 exercises, which serve to get you ready for the baseball season as well as to maintain your strength throughout the baseball season. This first series shows a rubber band attached down A low, like where you would finish your pitch, with keeping a stable torso and keeping your shoulders square. You bring your shoulder all the way back to the cocked position, and then slowly allow the hand down toward the follow-through position, with resisting the T, W, and V exercises. These are critical for scapular stability as well as the rotator cuff. This is one of our Astros pitchers. Notice he's off the end of the table, retracts the scapula, brings the arms out to form a letter T. The key is keeping the scapula in the retracted position while doing the motion with the arm. This helps you control your shoulder blade and keep it in the right spot. A similar exercise, this is called the W exercise. Again, with the shoulders off the end of the table, you retract the scapula, rotate to the cocked position, and then lower. Retract, rotate, lower. Ideally, the elbows would be a little bit less bent while doing this. However, this is still good form. Retract, rotate, lower. Notice the position of the lumbar spine, the lower back. It's in a stable position and not moving during the procedure. Similarly here, again, this is a V exercise. Bring the shoulder blades back, bring the arms up, and then lower, all while the shoulder blades are back. So shoulder blades come back, raise the arms, lower the shoulder blades. Retract, raise, lower, relax. Retract, raise, lower, relax. And look at his lower back. It didn't move a bit during the whole Pitching requires endurance of the rotator cuff with the arm or with the hand in the overhead position. So here, this is back to our collegiate pitcher who's working his rotator cuff by bouncing the Swiss ball against the wall with his arm overhead. This is using the DS2 platform. This is an excellent device for strengthening the rotator cuff. Again, the scapula is in the set position, retracted and down, while the athlete is swiping up and down, side to side, and in diagonals to work on the rotator cuff. Again, the scapula is in the stable position while the rotator cuff is working.